Hi, I'm Dr. Surindher. I'm the Director of Cosmesis India. We are an aesthetic and plastic surgery clinic in the heart of Bangalore in Brigade Road. Sometimes after fracture of the jaw, that is your mandible, that is the jaw, and sometimes post-operatively after the surgery is done and you have a fixation and everything, you might have some problems related to inability to close the lips or drooping or drooling of saliva or various other problems which can happen. Is this a common occurrence? No, it's not a very common occurrence, but yes, it is a complication of jaw surgery. It usually happens when there is a problem, when there is a complicated jaw fracture and there is either a tissue loss, where there is loss of tissue and because of which there is a lot of scarring and there is fibrosis. So that causes your normal movements to be hampered. Second is when there is a nerve injury associated. There are 2 or 3 nerves which come to the lower lip, which are the major nerves which supply the muscles around the lip. And when they are injured or sometimes they are closed, the fracture site goes through the canal where the nerve passes. So yes, they can be injured or they can be cut. So if that is the case, then yes, you might have problems with inability to close, or you might have problems with the deformed lips where on animation when you're talking the lips are moving in different directions. What do you do then? First is we have to evaluate what is the problem. We have to find out whether it is a tissue loss, whether it is fibrosis, or whether it is a nerve problem. Once we do that, we can either do nerve conduction studies, or we can do scans to find out what exactly is the tissue loss, and of course physical examination. If there is a loss of tissue because of which it's hard and it's fibrosed and your lip is not able to move or your lip is pulled down, then we have to do a surgery which is usually a flap that we have to do to bring in tissue there so that the tissue relaxes and your lips are able to function normally. By chance, if there is a nerve problem where you can find out by the nerve conduction studies that a major nerve has been cut, then we can go in and try and repair the nerve, or we can do in a nerve grafting, or we can do a crossover nerve grafting. So there are various options for it, but it is a more complex process. So it is always better to get it treated by proper trained people who can identify the problems right at the beginning and do the complete job right at the beginning. Sometimes what happens is the fracture is looked at isolated, and the facial fractures are nowadays treated by a lot of other people like maxillofacial surgeons, dental surgeons also. So sometimes what happens, the nerve injuries and soft tissue defects are not identified. So they do fix the jaw properly, but sometimes these things are overlooked, and then secondarily, once the healing is complete, only then we can find out. And sometimes if there is a combined team approach, yes, you can identify them and treat them at the first instance, which is the best time to treat it. Because if you can find a nerve which is cut or damaged in the first instance, and if you do a repair, by the time the healing is complete, the nerve recovery is also done. So exactly the same way with tissues. So yes, if there is a complication like this, it has to be evaluated. You have to find out what is the problem. Once the problem is identified, then yes, there are treatments available for it and it can be done.